Kalimera, everybody, and welcome back to Greece. This is Spiros' interview part 2. And what we're going to do...
David practicing his Greek.
It's what, sorry?
David practicing his Greek.
I am. You'll have to teach me another word because it's the only word I know in Greek. Kalimera.
Yep, going to work on it.
Oh.
But before, I have a surprise for you for part 2, David.
Oh.
It's an opening surprise.
Okay.
Now, when we met, you know, you being a Scot, a proud Scot, yes?
Yeah. What are you going to embarrass me now?
No. I'm going to show you. I want to show you like a Greek traditional similar to. Can you see me?
Yes.
Yeah.
Now, I remember you actually you emailed me a copy of that.
Yeah. This is called fustanella.
Yeah.
All right. Here, let me show you this. Sorry about this.
That's
I'm at
fine.
Mommy's place, so I found these old pictures. Can you see it?
I can just about work it out. So is this you when you were doing your national service?
At 20, 21, something like this.
And so this is traditional Greek dress.
Very traditional. You don't see this anymore, and only in national, parades, things like that. I dropped you again. You've been a bad
You're making
boy.
a habit of this.
It's all right.
So, what we were going to talk about in part 1, but this is now part 2, is actually a little bit more reflexology focused. So, tell me, I mean, you are one of probably the best known international speakers on the circuit, so to speak.
Then we're in major trouble as a profession.
But how did you get into reflexology? How did that all happen? Tell me the story.
Interesting question, because I just showed you my military days, right? At the age of 21. When I got out of the military, I was 21, no studies, no university, because from Canada I came to Greece. So I had a problem. I had to learn Greek at the age of 11, and this left me back in my studies, though I'm not sure that I would have even gone to study. All right, I was more interested as a youth, distracted, let's say. But when I got out of the army, I started training. I was playing European handball, and I went to my team, trying to figure out what I was going to do in life. And at training one day in September, a man in charge of the team, like a manager, he came up to me. He said, we have a doctor. I knew of the doctor. He was a general physician. And this doctor practiced reflexology. And he was tremendously successful, especially with sports injuries, but with, everyday people. He just got into, because he was working with my coach.
Mm-hmm.
And he needed a driver for 2 hours a day. So the team said Spiros can be his driver. Maybe he can borrow his dad's car and drive the doctor for the house calls at noon.
Oh.
So I walk in his office, la Calimera, and he had taken care. My brother was very good. I was never injured. I was a defender, so I never actually met him. I would send clientele to him, if you understand what I mean.
I see. Yeah.
But our best players would be treated a lot by him, especially sprained ankles. And for this, he would use cross reflexes a lot. Miraculous work.
Now, just to explain then, cross reflexes. So you're talking
for the left
So
ankle.
he would work the wrist for the ankle. Is that what you're talking about?
I believe is the referral area.
Yeah.
The wrist is the referral area.
Yeah.
But the wrist is carpal bones, so it would be for all the tarsal bones.
Correct.
To work the heel and the malleoli and the talus, which is the deltoid ligament and other structures there, common areas of sprain. You would have to go to these bones here. I am showing the 5th zone, my little finger. This is as calcaneus and talus on top. They're the only 2 bones, one on top of the other.
Yes.
We're used to seeing them like this because it's the way the feet come to us.
Yes.
But they're one on top of these 2 bones here are the only bones structured one on top of the other, and
Yes.
Achilles is three muscles, and actually three muscles, their tendons come and make attachment. It's so similar in structure. So you would have to, work on that area. Anyway, he was very successful. The carpal would be the referral area. The other foot would be the cross reflex. So this is
Right.
like, since we've stopped, such an interesting topic because it explains the results when you do lymph drainage with reflexology.
Mm-hmm.
And maybe I remember reading an article from the Feet First article from the Irish Institute way back, and there was a reflexologist doing volunteer work in Ireland, and she was in a clinic for burns, skin burns,
Mm-hmm.
and they utilized her in this process. And I imagine she would use these cross reflexes in areas on the limbs, burns, and things like that. But because you see, David, if it's a skin burn superficial, would you work deep on the other or superficial?
I would say superficial.
And if you had a fractured ulnar or cerquita, radial bone,
Yes.
radial, yes.
Yeah.
Would you press bone over here, muscles, tendons? What would you press on?
So straightforwardness says bone if you're going to be working on bone.
Now let's go even further. There was
Oh gosh, you're testing my knowledge now, aren't you?
No, I think it's obvious. It's just simple answers. But you are experienced. You're an educator, and I have to respect this. So that's why. And it's also a Greek way of learning the gestation method of Socrates, asking questions. And the answers come out because you already know them. And any reflexologist, basic training at least, understands these concepts, I believe, laws of similarity and so on.
Yes.
Now, what else is interesting is this university in the States, they made this announcement in 2007. Massage can be a muscle builder, something Hippocrates said. But what's interesting for reflexology is, the previous also is because we do have muscles in the feet where our reflexes are. Even on the opposite limb, they said, you can build muscle when I rub this hand, but even on the opposite limb, flesh will increase. Because in the spinal cords, there are these interneurons passing over.
Yes.
And that's why cross reflexes and referral areas in reflexology as a concept is positive, correct. Ingham proposes it in her original books. It's forgotten. Here in Greece, it's part of your basic training, early basic training. One of the first things students learn is how to utilize cross reflexes and referrals. So we have this research paper suggesting, rubbing this side will increase flesh, but also on the opposite. We know from other research papers, hey, because I speak with research, does it make orthopedic reflexology evidence-based now? Because this is all orthopedic,
So we're going to be research experts as well now then.
Well, I see, many colleagues saying evidence-based and all these fancy terms, and here I am also, can I use these terms? I'm being kind of ironical.
If you're asking me, Spiros, you say what you like.
This is like a Greek comedy now, just playing around. For the reflexologists listening, though, it is important for them to understand the effectiveness of cross reflexes and referral areas.
Yeah.
That there's research in working out. If you do your bicep, brachialis, bicep, only on this side, the other one they've measured gets 7% without ever flexing. It's because of these interneurons. These communication channels exist. They are reflexes.
Yeah.
Because you're not working on the damaged limb, you're working at a distant area. It's used in acupuncture. There's the approach of cross reflexes, acupuncturing, and so on.
Yeah.
But importantly also, and now I'm taking you to ancient Greece.
Oh, please.
Are you ready?
Go for it, please.
Yes, when the Greeks lost the war to the Romans and we were conquered, doctors were enslaved like all scientists back then. Now there was this Aurelius Celsus guy, and he ordered that encyclopedias be written and on all sciences. He says these Greeks, they know what they're talking about. We must gather this knowledge and write it down and spread it out. Something like what Mao did in China with Chinese medicine. He brought in the information, everybody had to give information, and now we have this collective of knowledge common around China, but it came from different parts. So they write this, these Romans, they write around 25 AD, they write the Encyclopedia de Medicina, which is taught in universities as part of the history of Western medicine. So it's based on these encyclopedia. Now look, what's interesting is all other encyclopedias were lost. We have fragments of them in other books.
Right.
But the Encyclopedia of Medicine is all 8 books. We have all 8 of them. And in these books, as a Greek, I'm proud to say that 88 Greek doctors are referenced by name. So
That's
they would say,
amazing.
David White said this, Spiros said bullshit, blah, 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 whatever. You know? Spiros is full of it and whatever. But the point is that in this Encyclopedia de Medicina is cited and about rubbing, the term, any manual work, rubbing, an Hippocratic term. And it is written inside that we rub one limb.
This is Antipatris, isn't it?
Sorry?
Antipatris?
Antipatros, no.
No? Ah, that's something else then.
I think so.
Okay.
I'm not sure what you're referring to. All right. So we rub one limb to benefit this limb. We rub a limb to benefit another limb. This is and cross reflexes. And he continues by saying, but especially we rub the limbs to rid the body of residues, the head and the trunk. And this could be reflexology because we rub the limbs to assist the head and trunk.
Yes.
So this quote on its own is very interesting. Getting back to cross reflexes and referral areas, like in Greece, we might, and the lymphatics, I want to get to the lymphatics now. We teach some basic techniques applicable, of course, to the feet, but then we and many schools around the world apply a lymphatic massage reflectively on the feet. Do you do this ever? Do you teach it to your students like this?
Yes, we do. Yeah.
So what you do, if you know, more or less, maybe you take care of the central organs and the major lymph nodes initially.
Yeah.
Okay. And maybe from center, you start going distal, depending on the limb and the physiology, of course, and then working more center and more distal and center. Yes, is that correct? Like, so you would bring shoulder, elbow, hand, all the time going back. Is that correct?
Personally, we work slightly different, but every school teaches something slightly different anyway.
A protocol.
Yes, a protocol. Yes.
All right. Now, when they do, what's the pressure like when you teach a lymphatic, the training, when the chapter is about the lymphatics? Is it your deep pressure, Ingham style maybe? Is it a light touch approach? Is it no hands? The advice you give? Like, what advice would you tell them to stay superficial, go deep?
If you're wanting to work on, my answer would be that if you're wanting to work on something that is a superficial problem, then you're wanting to work lightly. If you're wanting to work on a problem that's deep, again, then you adjust your pressure and you work deep.
I too will agree with you on this. It's my opinion. And going back to either a burn or a fractured bone. Yes. And so we see for lymph, we will work at a distance on the other limbs, and our pressure will be light. But our tutors keep us there for a long time because we're doing reflectively, we're imitating in the micro a lymphatic massage,
Yes.
depending on how you learned it.
And am I right in remembering, I've also seen you working even with brushes?
Yes, and it's good for lymph as
Yes,
it is
I
for the
thought
body.
so. Yes, yes.
And for Hippocrates and his humoral theory, the brush is wind element. And in lymphatics, you might want to bring in some wind to get things moving.
Yeah.
Yeah.
So getting
So
right back to my very first question, I'm trying to keep you on track here, Spiros, and it's difficult.
I just want to close this.
Okay.
Regarding cross reflexes and referral areas, I see around the world, and there are prominent educators on this lymphatic approach, but I see good results all around. And my proposal to why they're successful, my hypothesis, is based on these interneurons. And there is always the reflexology, but because of the variance in education around the world, yet good results around the world, I believe something's going on with the quality of touch on the non-affected limbs.
Right, right.
Just that. So,
no.
All right, what do you want?
So getting right back to the very first question I asked you, this doctor that you drove.
Oh, yeah.
You've even forgotten what the question was, haven't you? He got you into reflexology then.
You're going to love this. So I walk in, hey, doc, I'm Steve's brother. My brother was a star player, many sprained ankles, Dave. He would be playing in 2 days. Miraculous work. Old players that played in the Athens Olympic famous still see me and they remember these results from way back then. And the doctor is alive and kicking and has his office still in Nazmirny here in Athens. And so I walk in, hi, doc, I'm going to be your driver. It's all right, have a seat. When I'm ready, we go. And he was attending to feet. It's just what we do. Okay. And then the next one walks in, I hear the interview, the request. I see him going at the feet. So something's wrong here. Anyway, I go back home. I took him around a couple of houses. My dad asks me, hey, how was first day at work? I said, this doctor's a weird guy. He rubs feet all day. He says, he must be a con man, or, did he tell you anything weird, or did he touch you, or, all these things. No! This was Dave back in 1992, all right? 1992. People listening to this might not have been reflexologists, might not have been born then,
Oh, that's true.
Yeah. So you have to get into the mentality of 92, how common was reflexology. He was a doctor, and they would tell him, very good reflexologist, successful, and patients would say, get on TV, speak about it. If my association finds out, they'll have the best of me. I'm not going to do it. So, and one day he was late. His place was packed all the time. I started doing some secretarial work. He had some books, and the doctor said to me, one day he was late, and the client was, creating a fuss. I said, who's next? And she said, I am. And she was fighting with someone else for whose turn it was.
Oh, gosh.
And I said, walk in, we're going to start. And when the doctor comes, he's going to give you the main treatment and so on. And, that's how it all, he walked in, he saw me treating her feet. He said, what are you doing? And I got scared I was going to lose my job or something. And he said, no, it's all right. And he said, how did you know what to do? I said, you have these books. And because of Canada, my English, all the books back then were in English. You couldn't find books in Greek.
Yeah.
So I could read them easily. They were pleasant and, get an understanding of it. And he said, which books did you read? I said, that one and that one. And that's when he gave me Hannah Marquardt's book. He said, go get that yellow one. And then it was Inga Dugan's with Meridians was the second one.
Yes.
And that was colored a deep purple, fuchsia, we say in Greek, anyway, I remember the books. Take those down, have a look. And when you feel comfortable, come and tell me. So after a while, I said, hey, doc, some I understood, some was difficult. And that's how I started then, teaching. He taught me and working and practicing on, so many people inside his office. He was a general physician
Mm-hmm.
on the equivalent of your NHS. So
Mm-hmm.
people would visit for medication.
Mm-hmm.
He became famous. His story was an interesting one, how he learned of reflexology. And anyway, I could speak like for a lot of time about the doctor. He would give medication, let's say for your stomach, but he would ask the client, "Do you mind if I press on your feet for a while?"
Mm-hmm.
And that's how he verified the points, the method himself.
Right.
Give the medication, people would get better. And when the time of the year came when they had to choose a doctor, they would go to the offices, which is the next neighborhood to ours, and they
Yeah.
would tell the secretary, "I want for general physician, the man that he would use a wooden wand reflexology, the sticks,
Mm-hmm.
all right? He wouldn't thumb walk that much."
Ah, so he was a bit more like Father Joseph with Rocher.
Yes, yes, yes. Good on that. And back then, so was I. I learned to use good hands with Anthony Porter, Hagar Basis,
Yes.
Nico Pauli, later
Yes.
on, Hannah Marguard, Inga Dugans, many people. And in Greece, wand reflexology is big in a way. All right.
Okay.
They learn how to practice it. So he would use, and the people would ask, "I want the doctor that uses the wooden sticks."
Mm-hmm.
So the secretary was hearing it a lot. So she called him one day. He said, "Yeah, doctor, yeah. May I ask you a question? Are you by any chance the doctor that uses wooden sticks on the feet?" And he got scared and he said, "Well, yeah, but sometimes I have this approach." Okay, because people seem for you all the time. So I wanted to be sure. I was looking to find out which doctor it was. She
Brilliant.
was calling all of them, yeah. So that's how and that's how I got into it.
Right.
And after 9 years, went to study at a school here, the one I teach, and then got into, the practice on my own, which was
Mm.
like beginning from zero.
Right. Now, you are best known internationally for your orthopedic reflexology. Now, I've had the privilege of seeing you teach. I've been in your classes, and it is so different to what I would call classical reflexology. Classical reflexology is that press, 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 press. And with you sort of a lot of bone manipulation, isn't there, with orthopedic reflexology?
Not mobilization, we will use the word, and not
I
manipulation.
defer to you. I do apologize. Yes,
No, it's
absolutely.
not only to me, it's because do you teach spine twisting,
Yes.
this technique? So you
Yes.
mobilize bones also, or do you manipulate them? Do your students manipulate them or mobilize them?
I've never really thought, it's interesting. I've never really thought of the difference in the word.
There is, because manipulations can be done by specific professions. Low amplitude, high velocity, something they're described. These thrusts of
Yes.
placing bones, and we do not do this.
No.
I'm sure all colleagues hear a crack, a twitch, but the foot does it. It happened. It wasn't intentionally. The clients tell me, "Do it on the other one." I said, "No, only if the foot wants to. I don't do it on purpose."
All I can say,
You
Spiros,
mobilize with intention.
when you were working on my foot,
Mm-hmm.
and you were mobilizing then, let's call it
Yeah.
that, my calcaneus, it certainly felt an awful lot more powerful than an osteopath or a chiropractor.
You think
Definitely.
they have much stronger hands? People say, "Oh, Spiros, you must have strong hands." I'm not a masculine man, and I believe it's what you don't have in strength, acquire in technique.
Mm-hmm. Yep.
Or else we're gonna burn out our hands. I've
Very
been,
true.
at
Very true.
feet and doing manual work since '92. So you have to take care of these
You do.
limbs. I believe much in technique, but there's a lot of mobilizations. Mobilizations in many countries are divided in 5 categories. And you have the first 4 grades of mobilization, and number 5 would be a manipulation, if I remember. This does not exist in Greece. At the moment, it's not a regulated or statutory professions. So yeah, but they are mobilization, and this is suggested by Eunice Ingham in her original works. I very much believe in the original works of Ingham.
Uh-huh.
I think this unites us all around the world. Tini Porter has come out with a couple of articles lately talking about the dilution of reflexology.
He has, yes.
Yeah, and I'm glad he did, because he is a respected personality in the world of reflexology.
Very much.
Diachronikos, we say in Greek, through time. He lasts in time, you know?
Absolutely.
While if I were to speak, and I have spoken in this direction, he's new, and what does he know? And maybe, well, now it's Porter speaking. Successful, well-known, blah, blah, blah. So many good things to say.
Yeah.
So I believe Ingham, the original works and her original charts from the first edition, we can agree on that historical fact. And from there, go in any direction, as I've said. Hold on to the original, and then there's no stress. Go in any direction.
Yes.
You like. So she does advise it. The bones reflect. I have a model here. Reflect very well the human body, the shape and form, and we can see many similarities. And the more you look into the detail, you continue learning all the time. And, you know, this is, we work with the lower limbs most of the time. Then there are the hands, the ear, the face. How could you not know anatomically the area you spend so much time on? And you're, you know, it's the reflex chart, but how many reflex charts? I never provide, as you know, a new reflex chart. We have enough going around in the world. There's a little fly.
Oh, is that what it was?
Charts. Sorry?
That's what it was. I thought you were just clapping.
Yeah, I was applauding you. You're doing a good job, David.
No, you're absolutely right.
So many,
There are loads of reflex charts out there, and so many different places for different reflexes. It gets quite confusing, doesn't it?
And they're all successful.
Yes.
And that's how orthopedic reflexology came forward.
Okay.
Somebody has to explain that though there are different styles and from different countries, but even the same tutor trains a class, 8 students, 10, whatever, and they all go different way. They all heard the same lesson.
Mm-hmm.
They all go their own way. They mature, they, you know, change. They get better, they find themselves, which is correct.
Yeah.
And then they practice it slightly different. It's not good for research, is it, to have many different reflexologists practicing? And that's a good thing. That's what makes it an art. Somehow we have to, it has to be explained how these good effects or not good effects, why do they happen? And this is where I believe majorly Hippocrates comes. He brought into medicine. The medicine before Hippocrates was due to the anger of the gods, Apollo, Artemis with their arrows. They would send the plague or disease. Of course, the priests were experienced, but you know, they said the gods were in charge of everything because they, as priests, would have a good time. You know what I mean? Their villas and so on. But Hippocrates, though he is in the bloodline of priest healers, he comes out and says, no, we have to observe. In his books, he has case studies. Now, I say this because I'm against research, the way they propose it, or the reasons they say research is good. I'm totally against most of them. And I can prove it, you know, I can debate on it. But Hippocrates did case studies. And he, you know, he noticed, he observed, and he wrote, this is what happens when this and this and this goes on. And in this, I believe, because it helps the reflexologist, we learn from the other's experience. But when they tell me that we will be accepted by the scientific world, by academia, by all these people that lie, that are biased, that take money to, you know, all this shit's going on. there was this director of the British Medical Journal, and she said, after all these decades of working, there's a quote, "I'm sad to say I cannot believe anything I read anymore." And I see how I speak with people, how they get their names on research announcement or articles. It's like, it's just a fucking joke. And I
Yeah, how
remember
it
the
is,
massage, excuse me, now I really want to get to this.
Go
The
on.
Massage Therapy Association of Canada
Uh-huh.
had research on low back pain. And when the time came to go to their provinces or the guy in charge for funding for research, they said, "Hi, we have an appointment with you at 10, and these are our research papers you've been telling us we have to do on our own. And here are the results, and things look good. Can you hand over some money?" But on his desk was other requests of research from people lobbying.
Right.
Did the massage guys get the funding? So
No.
research is not enough.
Mm.
Research is, I know, like, you can try to educate me. It's a joke for me that anyone's going to educate me on the benefits of having research for all involved. Doctors, patients, the practitioners, so many people involved. But the way and where we are is reflexology. All right, I keep going, but it's not what's going to help us. Go, keep doing research. I understand, but don't overdo it. Like, it's not nowhere near. Do research that will help your everyday reflexologist be more successful. This should be done immediately. We tried this technique, we did this, it helped. I remember the research from the UK from Leslie and Jones, the two nurses, and they have 3 papers going out because they compared the heart reflex compared to the heel area. And they had a major issue because there was no agreement in the reflexology community of where the heart reflex is and what are the specific guidelines on how to work on a patient of cardiac interest. There was no agreement on anything, not even on the charts. And you know what they did, right?
Go on.
They went to the AOR and they said, "Hey, do you mind if we make a platform and have a chart, a square chart of the feet? And can you ask your members to tick with their cursor where the heart reflex is?"
Right.
Now, on the 2 feet, yes, things were in areas you would majorly accept, I believe, near the metatarsal heads,
Yes.
diaphragma line. This area was more bold.
Yeah.
But there were points also in other areas. Like, I was thinking, could they have been mistaken, with their mouse pad or something? Like, points were. And of course, there was again no common agreement, but as a zone, they did agree.
Yes.
And in that zone, we see major reflexologists placing their reflex points, like Ingham for angina. She's on the left shoulder area, by the way. Hannah Marguard is more behind the first metatarsal, left and right, because it's center. Inga Dugan's is solar plexus because it's kidney 1 point, the water element for fire. Father Joseph goes under the 4th toe, following Ingham, but it's also gallbladder meridian on top, wood element now. So it makes it, but as a zone, and they compared it to the heel. Now, since we're on this, and I hope I'm not boring you, when I saw the demarcation line for their research, they said, we'll compare this area.
Yep. The area below. Yes.
And this will be the sham reflexology.
Yes, that's it.
Yeah. But which is correct. It's a huge zone. So no problems with tiny reflexes, guys. Find the sore spot, work it out. The chart takes you there.
Which is exactly what Unisingham tells us to do. Find the sore spot, rub it out.
And the experience of all colleagues.
Yeah. Just for people watching this video, the piece of research that Spiros is talking about is called Reflexology has an acute hemodynamic effect. I do believe that's the one you're talking about, isn't it?
Leslie and Jones, yes.
Yeah, there we go. So.
And 2 other papers about the inconsistencies in charts they documented. Yeah. Beautiful work by the ladies. And it's a reality. But here comes orthopedic reflexology.
Yeah.
What I did was, I said, all right, what could be going on between the metatarsals and the heel? So if I peel the skin off, I see plantar fascia, then I see the first muscle group. And then suddenly in the second muscle layer, I see the tibial artery entering, breaking out. And what it does is it comes to the fourth metatarsal, where there's the origin of a muscle, turns around and comes horizontally like this and gives little branches in here.
Mm-hmm.
So there's a lot of blood distribution between the metatarsals and compressed like a sandwich between the muscle layers.
Yes.
Here, if you come to the heel, the distribution is much less.
Mm-hmm.
There is two arteries, one breaking up for talus and one for the calcaneal.
Mm-hmm.
And there's a lot of connective tissue and fatty tissue around here, like a honeycomb here, beautiful structure. Imagine all the striking.
Oh, I was just going to say, for all of that weight bearing, yes.
Yes, yes. But my hypothesis is that we do the pumping, the metatarsal kneading, it's called, I believe it, or maybe you move them. Do you recommend your students move the metatarsal heads?
That is
all
something
this diaphragmatic rocking.
Yeah, yeah.
All these techniques. If these arteries are compressed, the baroreceptor reflex, which has been researched in conjunction with reflexology, is my hypothesis is effective. So, the volume of blood going in the feet, the arteries of the foot become narrow. They excite areas of the brain stem, and this is automation of the whole body, which in turn affects the heartbeat. It will give it rise. Some hormonal action is going, dilation of arteries. So suddenly you have blood pressure. But if in that case the issue is compressed arteries in the feet, and your reflexologist, goes and works his heart reflexes, remember that big zone now, it coincides anatomically with the arteries present in the foot.
Yeah.
You would be giving space for the metatarsal heads. You would be relieving that sandwich.
Yeah.
Maybe there's some crystals, as Ingham proposes originally in her works, around the arteries, around the nerve endings. They travel together, the vein, the nerve, in major roots, they go together. So imagine for that sensitive spot, in one way, you could be releasing that tension on that artery or nerve, that area, that compression, somehow those bones mobilizing. But this will go message, scientists say, to the brainstem, independent of the chart. This is the issue. I, as a reflexologist, always remember the chart. I know my anatomy, of course, but I never forget my chart. I'm faithful to the chart. But according to scientists, this release will go again to brainstem, and it affects three nerves. The area that the message from the feet go with the baroreceptor affects three cranial nerves. And these are major, vagus being one of them, and he's famous. He has a parasympathetic effect on and homeostatic effect on the whole body. So in a way, it could be because you released an artery, one could speculate or propose, it has a general effect, or the body knows. You know your foot chart, Spiros, your reflexology chart.
Yeah.
But for a scientist, they could say, I see the root going, the suggestion. I see the suggestion here. Now, the issue for the world, for science and the patients, whoever is interested, is who's going to do the good work on the feet? Because only these weird people called reflexologists work with passion, safely and effectively on the feet.
Yes.
There is the matter of the map, but the maps have problems because the points change. And even anatomy changes. It's not the same on all of us. It's all right.
Oh, absolutely. And I remember you showing pictures of people's colons.
Yes.
Instead of it going up and across and down, it goes all over the place in some people.
Can happen.
Yeah.
Can happen.
Absolutely.
That's why Ingham's aphorism, find the sore spot when you're feeling out of kilt. kilter.
Yes. That's
You
it. When
wear a
you're feeling
kilt.
out of kilter,
Income said,
find the sore spot and rub it
don't
out.
know why or what about. Find the
That's
source.
it. That's the one. That's it. Yeah.
So let's keep it simple initially.
Yes.
Things have become very complicated.
Yeah.
And it stresses the reflexologist.
And I must admit, I always remember Nicola Hall.
Yeah.
She was talking to me a while ago, and she said, the study of reflexology has become so overcomplicated. We have to remember that it is actually a very simple thing to do to make your client feel well. And Tony, you mentioned about Tony Porter's blog, his 2 articles on the dilution of reflexology.
Yeah.
And he was saying that part of the problem today is that reflexologists are taught to expect to find certain reflexes. He says it should be the other way
Beforehand.
around. Yes, should be the other way around, that we go just
It's
examine the
Facebook's
feet
fault.
and allow the feet to tell us what the matter is.
It's Facebook's fault.
Facebook's fault.
Reflexologists got on Facebook like the whole world. They started asking from Greece, asking the world, I have a client that has this diagnosis. This is his issue.
Yes.
What should I work on? And possibly I answered or whatever, but how the fuck should we know? I'm in Argentina. How am I going to tell you in Athens what to do? Or the other way around? Are the feet in front of me? Only if you, and I'll ask you a question.
Yes.
When you touch a pair of feet and suddenly we change, I will complete the session. You've been working on them for, let's say, 10 minutes. And now I have another 10 minutes. Fundamentally, do you think the person will remain the same in my presence as he was in yours?
No, actually, that's a very good one. Yes, it
will the
change.
reflexes change? Will his muscle, like if he's stressed with me, suddenly, like the other guy was cheerful, he was a Scot, yeah, he felt nice. Now this guy, he's dark colored, he's Greek, what the fuck's going on, you know? His hormonal system, theoretically, his hormonal system, his musculoskeletal, his digestive, everything on him suddenly will be different, to the better or to the worse.
I'll tell you what, Spiros,
so how can we recommend to someone what to do over Facebook and all this? Not to mention, why are you asking in a group and you're not talking to your tutor? Did you buy a 40-pound course online? Learn reflexology with 40 pounds. Who's asking these questions?
Yeah.
Do you understand? If you got an online course, yeah, now you have a problem. Who you ask?
Oh, Spiros, yeah, that's it. There you go. I think you're back.
Yeah, I am.
There you go.
Can you hear me?
I can hear you. Again, that's, you pays your money, you takes your choice. If you're going to do a cheap course, you're going to get not a lot for your money. You do a course that you've actually got a lot of one-to-one tuition with your tutor.
People should do good techniques. There's good reflexology and bad reflexology. Good massage and bad massage. Get over with.
Yeah.
Then there are names. There's orthopedic. There's this. There's that. There's no hands. Who do you men think you are, David and Spiros?
Absolutely.
Reflexology is reflexology. Do a good job.
Now then, just to finish this interview off, you are a very in-demand speaker. What do you have coming up? Just so people know what you're doing and where you're going.
I'm pausing from traveling for a while. See what's going to go on. We've rescheduled London at Hagar, the Reflexology Academy. This is for October 21, and I hope for all of us things go to the better.
Yes.
You know, to act room, and because we touch.
This is it.
And we give space, so we have to occupy space together.
Yeah.
In order to give it out again.
Yeah.
Besides that, here in Greece, I hope things go well. I still have my course in Greece going on, scheduled in Tolo in September. I'm not sure. I'm observing. I haven't canceled it. So hopefully things will go through July, and then maybe I will encourage people to come or not. But it's something we observe day by day, week by week. And there is with RAC a webinar for friends interested. They can go to RAC's website. I'm going to have a nice presentation there with hosted by them. And shortly, my new child, Pedis Anatomia, is coming out. And this is an interactive way of learning the anatomy. So I've prepared a training series in English. And actually, I start building layer by layer the foot with Play-Doh.
I saw you doing something like this on Facebook.
Yeah, and I found it fantastic. Like during COVID, in order to, we always try to do a better job, and just by making it, I would learn more. I've been in this thing for so many years, and just by changing my approach, I had to learn things anew, and things were totally new, some details and so on.
Yeah.
And like the arteries, there's so many resemblance to the aorta and things like this and other structures. So this is going to go online from our school here in Athens. Yep.
Is there a website that people can find you on?
I have my blog, Greek Reflexologist, so you can visit, or my Facebook stuff.
Lovely.
Anyone who wants to find us knows how to find us. They just Google us nowadays.
Absolutely.
Our face is everywhere, isn't it, Dave?
Just a little. Spiros, it has been a delight chatting with you. I hope that everybody that's watched this video has learnt loads from you. Every time I talk to you, I learn something. So it's wonderful. Thank you so much.
I hope we together reinforce our faith in reflexology. And even I understand that I have begun working, and it's given me confidence compared to other colleagues around the world, making money, proceeding. But I am concerned. I'm enjoying getting back to the new, whatever it's called. But I am concerned. Be patient. And reflexology, we are so lucky because we've went through this pandemic, which is unimaginable, but it's proven that you don't need your books, you don't need your tools, you have your hands with you, your knowledge. Reflexology, we can work or practice what we love or offer, pacify pain, or this is what medicine is, one of two things: be of benefit, do no harm.
Yes.
So when time comes, we will be only of benefit. And we're lucky compared to other people. Be inspired by the presentation, by the story of Dr. Malon Locke, the Canadian. His town, Williamsburg, flourished. I'm confident about myself. Get the results, good techniques. Don't worry about, this way. Find the spot, do good techniques. Be a great reflexologist. We're very lucky compared to other professions.
We are.
We must things on the good side.
We are. They're great words to end this interview. Thank you very, very much, Spiros.
I like you, Dave. You're good.
You're a good man too. Well, guys, that was part 2 of our Spiros Dimitracoulas interview. I really hope you enjoyed that. Spiros is such a fabulous guy, and it was great to be able to see him again. He is so knowledgeable. What he doesn't know, gosh, he is just great, which I hope you kind of picked up on that interview. If you've enjoyed our chat, then I do hope that you would like and subscribe to our channel. If you do, that will then enable YouTube to be able to keep you up to date with what we have coming up. And we have got some superb reflexologists that we're going to be interviewing over the course of the rest of the year. So all that's for me to say now is do stay safe, stay well, and keep on loving reflexology. Bye-bye.